Welcome to Language Access Matters, the first podcast dedicated to language access and sponsored by Equal Access Language Services, the company whose mission is to promote language rights and end language-based discrimination through conscious language access services. For our first episode of 2024, we bring to you Safe AI, an initiative that seeks to disseminate and promote industry-wide guidelines and best practices for the responsible adoption of artificial intelligence in interpreting through facilitating dialogue and action among vendors, buyers, qualified practitioners, and users and other stakeholders. As my guests, we have four pioneers of the evolving landscape of language access and its interaction with artificial intelligence. In this digital age, the interaction between AI and humans is not merely transactional, it is transformative. AI is increasingly becoming intertwined with our daily lives and, I dare say, shaping a new shared consciousness. Amid this convergence, ensuring the safety and integrity of this interface is paramount, and today this is precisely what we will be talking about in this episode titled Disruption Without Disaster. Let's discover what the minds of these four movers and shakers have in store for us. They will certainly continue to inspire a future where language access is not just efficient but also ethically sound. We have Ludmila Golovine, is the President and CEO of MasterWord Services, a top-ranked LSP globally. She has dedicated over 30 years to the language services industry and for the past 15 has been an international speaker and advocate for language rights and social justice. She is the Strategic Partnerships Manager for the Global Community Programs of Women in Localization, a founding member of the Global Coalition of Language Rights, member of TBAT or Texas Business Against Human Trafficking, active participant in the UN Global Compact Initiative, and chairs the Advisory Subcommittee for the Translation and Interpretation Program at the Houston Community College. Her work has been recognized by numerous awards, including California Healthcare Interpreting Association, CHIA, or CHIA, Trainer of the Year Award 2021, Houston Business Journal's Women Who Mean Business Award, and Congressional Recognition G7 Excellence in International Service Award. We also have Carla Fogarin, registered nurse, certified Americans with Disabilities Act or ADA coordinator. She has served as the System Director of Diversity Initiatives, Interpreter Services and ADA 504 and Section 1557 coordinator for a large healthcare system with 42 hospitals, 6,000 providers in 11 states. Carla is a national consultant on language access, health disparities, disabilities, and regulatory requirements for hospitals. She had created and implemented bilingual clinical staff language assessment to comply with Section 1557. Carla has performed over 60 gap analyses for hospitals and clinics to assess compliance with the Joint Commission, DNV, ADA, and other federal and state requirements. She participated in the creation of the International Medical Interpreters Association's Standards of Practice and helped to promulgate the interpreter law in Massachusetts. Carla served as vice president of the IMIA and was a founding member of FOCIS. She is currently the vice president of the National Council on Interpreting in Healthcare. With us tonight is also Dr. Bill Rivers. He is principal at WP Rivers and Associates, a former Russian English translator and interpreter, Russian teacher, academic researcher, and administrator, and for-profit and non-profit executive. He has more than 30 years' experience in language advocacy and capacity at the national level, with significant experience in culture and language for economic development and national security in the intelligence community, private and academic sectors, and publications in second and third language acquisition research, proficiency assessment, program evaluation, and language policy development and advocacy. Timothy Riker is a senior lecturer in American Sign Language at Brown University. He is a member of the advisory group on AI and sign language interpreting. He is a senior lecturer in American Sign Language at Brown University and research co-investigator with the Deaf Yes Center for Deaf Empowerment and Recovery. Through his deaf-led team's community engagement research, Riker has collaborated to develop linguistically and sociopolitical correct methods of inquiry when conducting deaf qualitative research. The research team leveraged technology so they could analyze sign language data while reducing bias found in traditional methods of inquiry. I feel very privileged to have 4 fierce advocates in the language access space as my honored guests. It is a great place to start our 2024 podcast series. All of our guests are involved in making sure that artificial intelligence is used safely when delivering language access services to the limited English proficient populations and the deaf communities. So, welcome to our podcast. Well, I feel privileged to have 4 fierce advocates in the language access space as my honored guests today. It is a great place to start our 2024 podcast series. All of our guests are involved in making sure that artificial intelligence, AI, is used safely when delivering language access services to the limited English proficient population and the deaf communities. In fact, they pioneered the Safe AI Task Force. Within this context, I would like to ask our guest, Bill, to describe what is Safe AI, the primary mission and objective of the Safe AI Task Force in the context of language access. Bill.
So, Safe AI, which stands for Stakeholders Advocating for Fair and Ethical Use of Artificial Intelligence in Interpreting. Safe AI is a grassroots movement which brings together people from all sorts of different backgrounds, interpreters, spoken languages, sign languages, language companies, healthcare language access coordinators, educational language access coordinators, conference interpreters, interpreters from all sorts of different areas of the interpreting world, researchers, academics, regulators, all looking at this phenomenon of large language models, of Chat GPT, of Bard, of whatever Microsoft has renamed their product this week, um, which burst on the scene about a year ago. We all remember, okay, Chat GPT is going to change our lives, et cetera, et cetera. And almost immediately there was an enormous push towards, well, we're finally going to be able to replace those pesky humans, those hard to work with humans, those hard to find humans, and it's going to provide all sorts of language access. Everything's going to be great. It's going to be wonderful. Okay, so whatever, Silicon Valley, or you take that. But the reaction from the people who provide language access, who need language access, who use language access was, well, let's slow down and think about this. And so in a number of conversations in the spring of last year, of 2023, it's like, can we get together and come up with basically some guidelines, some guardrails about the use of AI in interpreting, whether that's conference, educational, healthcare, community, spoken language, signed languages, ASL, BSL, QSL, etc., in order to give regulators and lawmakers in the U.S. and elsewhere an understanding of what we think makes sense in the current, 2023, 2024 space. We're not saying that you can't use AI. We're not saying that it's not going to change things. But before we go adopting it in its entirety for every potential use, let's think about what that really means. And that
Right.
was, that was last spring and into the summer. Since then, there's been a lot of reporting about AI. There have been about large language models. There have been numerous examples of the failures and successes of AI. If you're a lawyer, I'm not a lawyer, I'm a linguist, okay? But if you're a lawyer, it's apparently not a good idea to write your legal briefs using Chat GPT because kind of make stuff up, There's been research articles from computational linguists pointing out that, the data aren't all that robust in languages other than English. And so there are lots of little signposts that we're seeing that say, okay, collectively, let's take a deep breath before we plunge into, as a language access community, or in particular, the people who pay for language access, the healthcare systems, the school systems, plunge into the wholesale adoption of an unproven technology. So that's one
Right.
piece. And the second piece is to get the regulators, the U.S. Department of Health and Human Services, Office of Civil Rights, to pay attention to this. They pay attention to AI in healthcare in the diagnostic context. They're very concerned about potential bias from AI in looking at, CAT scan images and pathology slides, right? Very important stuff, but they're concerned about bias there. But we haven't really had any indication that they understand that even if this is a quote unquote non-clinical use of AI, it still needs careful examination, and especially in the healthcare language access space.
Awesome. So you mentioned that it definitely has impact in all the delivery of services. And I actually remember when Carla called me, I was in Spain early that summer, and we started thinking about a possible podcast. So I would like to ask Carla actually about the impact of AI technologies for language access. How does it impact the delivery of health and human services, including mental health, to linguistically diverse and deaf and hard of hearing populations?
Well,
What would be the key benefits, Carla, if you will, and challenges associated with this implementation?
I've done nothing but think about this, like many of us on here today. But I don't think AI is going to completely replace humans in this field, but it's definitely going to shake things up. I think you'd all agree with that. Remember when OPI and VRI were introduced? It changed the game entirely. What is a fact is that how we practice interpretation and translation will change and continue to evolve into something that is yet to be defined. The thing is, we must strike a balance, like Bill said, between pushing forward with innovation and making sure that we're still looking out for the folks that we're committed to serve. It is natural to feel wary about new technology, but we can't let fear hold us back from the progress. Just look at how far we've come in healthcare over the last century. Penicillin, vaccines, insulin therapy, stem cell therapy, the list goes on. Innovation's been a big part of that. There's a lot of dialogue, Carol, sometimes heated dialogue about the potential benefits like real-time translations, easier scheduling, cost savings, you name it. But there are hurdles too. Context, culture, complex medical terminology, sensitive conversations, privacy issues, the biases that Bill brought up, the vagueness of liability. Who is liable for errors? Is it the provider or is it the product, the AI product? Who owns the content? Particularly sensitive medical information also raises a lot of ethical concerns. The most vital for me personally, as an interpreter and as a nurse, is the lack of emotional connection and trust that comes with dehumanizing interpreter services in healthcare in general. So let's switch gears a little bit. Mental health, as you know, it's a passion of mine. But mental health and AI, now there's a combo you don't hear about every day. But trust me, it's really worth paying attention to. Telehealth screenings, distance counseling, they're changing the game, especially for patients who might not have easy access to care. And with the shortage of physicians looming, we need all the help we can get. By 2035, it's projected that we'll have a shortage of over 81,000 physicians. I live in Massachusetts, which is considered a medical mecca, and it's taken me over a year to secure a primary care doctor, with my first appointment being in November. And I know how to navigate the system and I speak English. The potential for AI in the scope of mental health, along with vigilant oversight, is promising, especially for ongoing counseling and therapy. I am certainly not recommending or suggesting it in any way for acute mental health care. Telehealth-based mental health screenings for patients who are LEP and deaf have significantly improved accessibility, particularly in those regions with lesser resources. Providers can increase their patient volume. The distance counseling has provided LEPs and patients who are deaf with immediate access to critical mental health support with the integration of interpreters into most of the telehealth platforms. A lot of the AI-driven tools can also help providers and patients to participate in online counseling. As a result of these types of tools, there's flexibility of time. For instance, that helps ensure that you can reach a mental health provider at any hour and not just during the traditional office hours. It helps to reduce transportation barriers, and provided that both parties, and this is a big provision, have reliable internet access, it can contribute to the increase in accessibility. And, as you know, Carol, from your own professional background as a social worker, the therapeutic relationship between a patient and a therapist is the foundation of psychiatry. The connection is based on trust, empathy, and the nuanced understanding of human emotions that the therapists supply and is not easily duplicated by AI. Think about that for a moment. While AI can help with the diagnosing and offer support tools, it's very unlikely to fully replace the human capacity in mental health care, including the utilization of interpreters. Recent research from MIT and Google shows the data obtained from AI wearable devices. Our kids all have them. I have all grown kids. But you can monitor your health indicators such as heart rate, blood pressure, oxygen saturation, activity level, how you sleep. This data has been very helpful in improving health prediction and overall outcomes for patients. I truly think that you need to see AI as a complement to healthcare and to streamline administrative tasks to allow us to focus more on patient care. This approach can lead to improved outcomes for patients while keeping their human touch that is so essential in healthcare. All this, though, must be done very carefully with monitoring, auditing, and testing. Again, it's about finding that perfect balance, right? Harnessing the full benefit and potential of AI while minimizing potential harms. So, we've
Yes,
got a lot of work to do.
and I love the phrase that you said right at the beginning. We can't let fear holding us back from progress. But how do we implement that progress is, I guess, what you are describing here. right? And we can do an entire podcast on how this progress is going to affect the profession of interpreting and translation. You also mentioned about this emotional connection and the human touch in mental health, which is absolutely important. And in psychology and social work, we call this rapport. How do you build rapport with your patient? And yes, we can't really task artificial intelligence to do that, and they cannot develop trust for us. So what you're saying is so key, and it brings us caution and hope in this space, in the space of mental health, in terms of removing barriers, but not fully replacing humans. But definitely, we're finding new topics to delve in our podcast when it comes to AI. And moving on to that, to the next question, Carl, I actually have a follow up. What strategies and safeguards does the health and human services sector need to employ to ensure that AI driven language access solutions comply with privacy regulations, accuracy, confidentiality, and other ethical concerns?
Well, I think we need stringent regulatory oversight, right, to help with this. I mean, I researched that there were over 40 states have hundreds of bills related to AI sitting in front of them right now. And there was another task force that was just formed by the Secretary of Health, I believe it was, so that people like AI companies, et cetera, can work together to mitigate some of these concerns. But I mean, how do you mitigate these things? There's so much bias in clinical algorithms, right? I mean, AI learns from the past and it builds on it. So if the past data is biased, then it's going to continue to be biased. So we really need to be really careful because it can lead to unequal treatment and even worse in health disparities, which is what we're trying to reduce or eliminate, right? We also know that AI generated content is not always accurate. So it could be detrimental in healthcare, a life and death, potentially leading to an incorrect diagnosis or treatment, right? Ensuring, like we just had a couple of insurance companies that were sued because they were using a very poor AI product in determining whether people should receive care or not in long-term facilities. Three people were removed from those facilities. Two of them ended up passing away. And hence, there's a big lawsuit with that. These two companies knew that the product was faulty, but they continued to use it anyway. So it's not just an oversight. We have to hold people accountable, right? We have to hold them accountable. And another component of this is that patients need to know when AI is being used. Patients need to know so that they understand that it's being used in their care and in which way. They need to have informed consent. I think it's absolutely crucial. And then I mentioned the accountability for errors. I mean, I think this is something that we're going to continue to see. Hopefully, it will get less and less. But if people just keep brushing this underneath the carpet, we're never going to get better or improve this. And then my other concern is in triage and life and death decisions. We all know that during the pandemic, horrible things were happening to people with disabilities. And horrible things were happening with people that had chronic illnesses. They were literally being triaged to the back of the line because whoever was doing this felt that they could help other people more, or that the other people were perhaps, quote, more worthy of helping and had a better success rate. I mean, we've got to be very careful with how this is utilized, especially in those kinds of emergency disasters. Um, again, I mentioned stringent regulations. We need to really make sure that the task force that was just established is called the U.S. AI Safety Institute Consortium. It was established on behalf of the Biden administration. Communication, not only communication to providers, but to patients, to the general community. The education and training shouldn't just be to providers. Again, it should be to the patients and the community as well. The more people are informed, the less anxious they'll be about things, or the more questions they can ask about AI. And then again, the monitoring and auditing. I read that there were a couple of countries that were actually hiring hackers to test the AI. So I think we need to go that route. We need to really think of all possibilities to safeguard the things that we all stand for, the patients, the people that we care about, our loved ones, and ourselves, because we're all going to be impacted by this. But truly, if I'm a woman, I am a woman that had a mammogram, for instance, if AI can interpret my mammogram and discover 30% more cancer, then I'm all for it if it's going to save lives. Again, we just have to safeguard it. We have to put bumper rails like in bowling for kids on it and make sure that it stays where we want it to stay and that it doesn't go rogue on us.
And essentially, you're describing the healthcare industry that actually, I didn't realize this when I was creating the questions, but all of this can become a legal concern, and how those safeguards both go for both the healthcare industry and also the legal industry, right? So I want to shift gears a little bit and ask Tim, how can we ensure that artificial intelligence systems are developed in a way that prioritizes language accessibility and inclusivity for deaf communities, while also maintaining high levels of safety and reliability? Tim.
Yes, hello. Thank you, everyone, and thanks for inviting me. I'm a member of the AI task force, and we have a deaf advisory group as well that monitors sign language interpreting. So we definitely have a strong collaboration, and we share our recommendations on the process, the language, ongoing requirements, community collaboration to make sure that we have a strong policy recommendations, have strong safeguards as mentioned. So to ensure things now and then as things happen in the future that we have the flexibility to adapt, edit, and change as necessary. As a community, the community is represented by a variety and diverse people. Language, culture, identities is very, very diverse. And the needs as a result are very diverse. So the deaf community is just one group, but it's homogenized by a variety of individuals. So we need to be aware and plan and prepare in regards to policy and lawmaking that it applies to the diversity of the community. The deaf community includes deaf, deaf blind, deaf disabled, latent deaf, hard of hearing individuals. The community itself, the diverse community itself, also includes using of sign language, also spoken with assistive technology, different devices and technology being used. Globally, there's over 300 different sign languages that are used. And linguistically, we've only started to study just on the surface of that. There's more languages out there that have yet to be truly documented and discovered or researched. As a result, the data out there has not fully been included in this process. You have to recognize the deaf community is very diverse with intersectionality of ethnicity, race, gender, sexual orientation, class, different identities that contributes to the diversity. So, as a result of the intersectionality that impacts access, language, education, general society, members of the deaf community historically have experienced challenges with education, language deprivation, because there are systematic barriers to early exposure to language, getting quality education with good quality interpreting services. We have a history of impact as a result of these things. Language in the community, again, is very diverse, from no language at all to a high level language user, college level, PhD, doctorate study individuals, and everything in between. So as a result of that range, okay, now let's talk about AI. Are we going to have an AI or machine model that can adapt and fit to everything that I've just mentioned? Globally, the deaf community is 80%. 80% of the deaf community does not have language access or education. So globally, as a result, deaf individuals if they have access to receive the education and then the language, there's only 1 or 2% that have everything. So these barriers fully impact the generative AI and being a solution, a one size fits all to the diverse population. More importantly, deaf people need a spot at the table. They have to be involved in the process. They have to be involved in the solution focused alternatives. They have to be involved in the situations. They need to be involved in the decision making. Deaf individuals have to have a role. People cannot be deciding these things without the people I've just mentioned. It's absolutely crucial, imperative. Thank you.
Thank you, Tim. And let me tell you how excited I am that you are bringing your perspective. I have been dreaming about a podcast where we put together the needs of the limited English proficient population and the deaf and hard of hearing communities, because I think the the points of interaction are plenty. You mentioned just a few of them, but diversity is the most the key or the principal point in common is that there is so much diversity both in the limited English proficient population, the deaf and hard of hearing. They have all these intersectionalities as well, and I'm looking forward to getting a conversation started where we understand how inclusion of these communities is so important for us to have a conversation or a discussion towards or related to AI and how it impacts the service delivery. So I am delighted that you're here today. Now I want to ask our guest, Mila. If you and Mila, I hope it's okay. I can call you Mila. And everybody, I love that everybody has a short name, except for Carla and I, right? Can you describe any recent initiative or project undertaken by the Safe AI Task Force to improve language access in AI applications?
Well, Safe AI Task Force initiative is actually, I believe, the first one in the history of the language industry where every single group and community involved in any way in language access came together with including international participation in this case. And as a first step, we launched a survey, a very comprehensive survey, where I identified 11 stakeholder groups that are involved either on the receiving side of language and communication access or as organizations that require language and communication access, including conference organizers, including educational organizations, schools, universities, courts, of course, hospital systems. And the survey was launched was translated into 9 languages so that end users, the limited English proficiency population, can participate as well. And as a parallel effort by the Deaf Advisory Group was launched within the deaf community to get the perception, to get the idea what is the impact of AI, what impact can it have, what guardrails can be established. And we're actually going to see the results of this work coming out here at the end of February. There will be initial presentation for the stakeholder assembly, which became, in a way, a governing body for the Safe AI Task Force. Initially, about 600 people responded with interest to participate. People volunteered to be part of the stakeholder assembly. Everybody who volunteered was accepted, and so it was established as a governing body. The 2 public meetings will be held on February 29th for the report done by CSA Research that conducted report mostly focused on spoken languages. However, I believe some ESL interpreters and some members of the deaf community may have participated in that report as well. We haven't seen the report yet, so we'll find out. And then on March 1st, there'll be an open forum meeting where the Deaf Advisory Group will present their results. So from that, the two groups or the different groups, the committees will launch their work further in terms of there's a guidelines committee that will start working and will be establishing next steps and guidelines and additional outcomes. So that so far the initial effort has been focused on finding out information and identifying opportunities, because there are absolutely tremendous opportunities with new technology, but also identifying challenges, because AI, and even when we talk about AI, it's also important to remember that maybe American Sign Language will have some automation today. What about the other 300 languages in the sign language? Maybe the core top 100 languages will have some component of large language models, even though the large language models are built today for much fewer languages that even machine translation is in existence. What about the other 6,000 plus languages or 7,000 languages? What about the other half of the world or the majority of the world? What happens there? Will those people be excluded completely because of the digital divide and lack of digital access? Which, by the way, you don't have to be left behind a digital divide just by language. Many English speakers, as became evident during the pandemic, were left behind the digital divide. Will you be left behind the linguistic divide? So there's a lot of things to take into consideration.
And I love that you are bringing that to the table, the immense diversity of languages in the world and how we need to expand our conception of language access to the world and not just in our country. Or so I and you mentioned also challenges. And I would like to ask Bill about some of these challenges when advocating for both language accessibility and safe artificial intelligence. What specific challenges and opportunities do you see in the intersection of these two important areas? And what strategies can we employ to address potential conflicts or trade offs between them?
That's a very good question. And, I look at this through my role, my day job as an advocate and a consultant. So, all of the people, by the way, who are working in Safe AI, this is all volunteer work. Tim and Carla and Mila, everybody's doing this as a volunteer. But my day job, I'm an advocate for the language industry, for language access, for English learners, for multilingual education. And so I think about how the federal government, whether it's the legislative branch and the Congress, makes laws, how the executive branch, like the Department of Health and Human Services, interprets those laws and writes regulations based on those laws. And I mentioned this, I alluded to this earlier. When we talk about AI in healthcare, as Carla pointed out, there's actually a lot of focus on the potential biases in diagnosis, right? And using AI for diagnosis, potential biases in using AI for back office workflows, but nobody's talking about language. And sometimes I get frustrated because the language access part is treated as, a box that gets checked off, right? Oh, well, we've got a contract with a language company. We've got a contract with an ASL agency, so we're good. We don't have to worry about the quality of language access or how often it's provided or anything like that. So, for example, the task force that Carla mentioned about the Department of Health and Human Services established for AI in healthcare does not include any references to language access. There are 20 million limited English proficient people in America by the census definition. There are more than 70 million total who speak a language other than English at home. A great many of them, if they show up in an emergency room, will need an interpreter, even if the census doesn't define them as limited English proficient. There are at least 5 million deaf and hard of hearing individuals in the United States, and they will need interpreters. They will need language access and assistance. A great many of them are atypical signers who, for one or another reason, are not as fully proficient in ASL. There are a growing number of deaf people coming into the U.S. as immigrants, speaking, signing Mexican Sign Language, or which is, I guess, LSM, Lenguas Señales de México.
Lenguaje mexicano, it's
Right.
lenguaje de señas mexicano, LSM.
LSM or LSQ, Langue Signée de Québec. So, I'm killing the interpreters here by speaking languages other than English. I'm very sorry, Kelly. How do we provide access for that? So making sure that language is included in the regulatory menu, if you want to call it that. And that's part of my job, right? To say, okay, we've got the Safe AI Task Force. We've got this big old survey we did. We have this enormous qualitative study of a significant number of hours of conversations in the deaf and hard of hearing community and the deaf advisory group, all of them pointing to the need to include language access in the development of laws and regulations.
Yes.
Because there's Silicon Valley out there, and it's done great things. We all have our phones, we all have our smartphones, right? Live or die by it, right? You claw it out of my cold dead hands. But the ethos, the philosophy is to move fast and break things. And okay, but that might be fine if you're developing apps that don't affect people's lives.
Yes, you point at something that I want to emphasize, which is that language access is not just a box to be checked on a form, right? The endeavors that Bill is involved in, and that Carla and Mila and Tim are involved in, is in really a change of consciousness as far as how our society conceive language diversity in our country. And this is precisely the motivation for a podcast like this. How do we go about language access in a way that we incorporate policy at every level? Meaning, not only, hopefully we make laws associated with language access, but also at the level of the businesses and any public service. We need to think about this in a much more comprehensive manner than we are doing. So it is inspiring to see that Bill, among all the efforts that he does, is one is a key one, which is development of policy. With that, I wanted to ask Tim, how does the Safe AI Task Force collaborate with linguists and experts in language diversity to enhance language access in AI technology?
I apologize. My Wi-Fi dropped out.
No worries, Bill. It was
in the
seamless.
middle of a rant about making sure that the people making decisions, and we have to be at that table. And part of my job is to get us to that table.
Yes, exactly. And so
I apologize, because Silicon Valley moves fast and breaks things. And I think one of my kids decided to start playing Minecraft or Roblox and kick everybody else off the internet at home. So
yes, no, it's absolutely to have that seat at the table, to have a change of consciousness. Shameless plug, I am going to post an article I wrote about how thinking about language access should be even a social advocacy effort or a social justice effort, actually. So I'm going to link that in the bottom when we publish this podcast.
Carol, can I
yes.
just add something that's sitting
please.
heavily with me? We're all talking about getting a seat at the table. So Tim, if you're ever at a table and linguists are not there, spoken language, ask where we are. And we should all be doing the same thing for our community, a deaf community. If they're not at the table, we should say, why aren't they here? Why weren't they invited?
Yes.
You know,
Why
it's
aren't they
always an
represented?
afterthought. You know, look at all of the telehealth platforms that went into place. And then they went, oh, how do we do this with LEPs or patients who are deaf? It was an afterthought. And we should be advocating for each other, for all of the different linguistic communities. Miller works with all of these indigenous languages and very languages of rare diffusion. Again, how is it even going to be feasible in any way? It's not equitable now. Is the divide going to get greater instead of shorter?
Narrow it. Yes.
So sorry for interrupting, but
No, I think that's absolutely key, Carla. I think it cannot continue to be an afterthought in every project. And one of the most important things I learned as a project manager is that you have to have all your stakeholders, your possible stakeholders at the table before you start a project. And one short anecdote from the hospital I used to work for, they were building these new buildings, brand new buildings at the hospital, and the language access team was not invited. And back then, the technology wasn't like it is today. So they had to think about phone plugs in certain locations of the room to be able to, special phone plugs to have those two can talk phones, which are phones that have two headsets for the language, for language access. But it was an afterthought, and then they had to make this remodeling because they never included the language services group in the planning of this building. So I really think is that at every level we should think about language access. When we create a document, when we make a building, the same way we conceive accessibility for anybody that cannot that uses a wheelchair, we have to think about accessibility for people with limited English proficiency or a deaf and hard of hearing community. So I agree with you, Carla. If they are not there at the table from the beginning, ask where are they? And Tim, I think it is time now for your question. I'm going to repeat it. How does the SAFE AI task force collaborate with linguists and experts in language diversity to enhance language access in AI technologies?
Yeah, I think that's a great question. Thank you so much for asking me. I think what's important again is to recognize the diverse way of accessing language. For example, if you use VRI, especially when the pandemic hit and onset of COVID, many entities, hospitals, things of that nature realized, okay, VRI became very, very popular. And, trying to access a spoken language where you can hear, and then applying that to sign language, it's like, okay, well, we have to have a clear video. If the Wi-Fi is not good quality, or if someone perhaps lives in a basement or an emergency room, there's a lot of interference that happens in the emergency room. So there isn't a good video stream quality for deaf. So they implemented bringing in these screens and said that was the fix, the catch-all. But what about a deaf blind patient? They can't see that. There's nothing tactile about VRI for a deaf blind individual that's in the hospital or at work or whatever. So that they have their own way of communicating, whether it be tactile or pro-tactile communication language. So that group was completely ignored. They thought, okay, well, VRI is now the grandiose solution and one size fits all, but it's not. So same thing goes for AI. We need to make sure to check and double check. We need to have prototypes and we need to have testing sessions. We need to make sure that we're understanding we're using different languages from other countries, from people that move, or just the variety, the diversity that comes with the population, even from other states that maybe move from state to state. So do we have an AI platform that's ready for that? Do we have the quality for that? Can we handle that? I worry about deaf individuals and are they involved in the decision-making process? If the hospital decides to go forward and use this XYZ technology in order to save save a dollar or to cut a budget, okay, but deaf individuals weren't involved in that conversation, in that decision that's impacting your life, your livelihood, your health. So society at large, in general, it automatically becomes inequitable for individuals. So we need to build a system that is not for deaf people by hearing people. It needs to be for deaf people by deaf people, and we need to have it designed as such. If we accept new technology that's being invented, great. Well, if we're not involved, that's going to even set us even further behind. Like, for example, the invention of the telephone. When the telephone was invented, deaf people were left behind for 80 years. 80 years. We had, before we had the advent of the technology we have today with text messaging and emailing and digital communication and video phones, things like that. So, but it took us that long to catch up. That's how far behind. Then we had to have two webcams, one that faced out, one that faced in, so on and so forth. So we've been waiting 100 years for these type of things. So with AI, I don't want to wait. I don't want that to happen again and have history repeat itself. Deaf people need to be involved now at the advent of this so that it can be equitable going forward.
Right. And so, as a follow up question, and you can answer this, team. I had put Bill also as a person that could answer, but how does the Save AI task force engage with underrepresented communities, meaning the limited English proficient population and the deaf and hard of hearing? How do they engage in language access to address their specific needs? I guess, Bill, you had already prepared for that question. So, but team, of course, you are welcome to answer it as well, both of you.
So as far as the how, again, inclusivity, technology, it's designed for a variety of people, a diverse group of people. That's how. In the process of development, when you're developing new technology, when they're in a hurry to make something, and it might be an absolutely great idea, maybe, but it's relying on sound, or maybe it's relying on voice recognition or sound-based recognition. So we think that that is great, but deaf people often become an afterthought. It's like, oh, okay, well, people that sign, well, you can't talk, so this is sound-based. So it becomes an auditory centric, an autocentric, if you will, focus on that development. So again, people don't have access. Large group of people will not have access to this great technology, so to speak. So if it's sound based, okay, well, are we also including gesture based, sign based? We need to open up our parameters and open up that range so people can be included. People who have limited language, for example, like English, maybe from the start, they need to be involved in the development process from the onset, not as an afterthought, but from the beginning. So once you get to the final product, it can be applicable to a wide range of people. If we're inventing something that's made specifically for finances or, for research development, or other technologies, again, possibly having a combination of a sound-based technology with other things so that we can keep up with the game. What I've seen so far is a lot of speech recognition has taken off. There's a lot of financial funding, collaboration, partnership with sound-based. But when it comes to sign language, it's just getting started. It's not getting that support. It's already behind. So we need to make sure that we're closing the gap between sound-based or speech recognition and other systems so that we have an opportunity for financing, funding, and collaborations. But again, it's everything is in a hurry. Do it right now.
Yes. Excellent. Bill, do you have anything to add to that magnificent question answer?
Within the task force itself, when we started the task force, we made deliberate efforts to reach out to the Registry of Interpreters for the Deaf, to the National Association for the Deaf, so that we were getting that community's engagement in the task force. And that's been a process, and it's been a learning process for everyone, because there are an awful lot of interpreters or former interpreters. I'm a former Russian interpreter. An awful lot of people who have bilingual, bicultural backgrounds. But when you're in the spoken world and you say, okay, well, I grew up speaking French and I'm a Russian interpreter and I've learned a bunch of other languages and I'm a fairly sophisticated cosmopolitan person, but then there are still nuances about other cultures that I don't know.
Mhm.
And that's been an important journey for me personally. And I'm very thankful for the opportunity to work with our deaf advisory group. There are a lot of, as I said, there are people on this call, there are at least two of us who grew up with a language other than English, plus Tim with sign language. So Mila and Carol. And I know Carla and I grew up with other languages in our families as well.
I still say that I am an LEP because there is so
You know,
much
I'm
about
I'm
the
not,
English language that I don't
I'm
know.
still working on my English.
Yeah.
But so we do have a lot of diversity, cultural diversity within the group. But what we don't have is, and which has been a real challenge in the Safe AI, but it's been a challenge in every language access project that I have ever done over the last 25 years, is getting the point of view of those limited English proficient residents and citizens. And for a lot of reasons, as I said, 70 million people, the largest proportion of the US population in history that speaks another language, that comes from somewhere else, or was born somewhere else, or whose parents were born somewhere else. But it's very hard to get people to trust, to come forward with their issues. We often end up advocating on behalf of the people whom we serve. And it's really often, it can be very hard to get those folks to step forward for lots of different reasons. And, we can elaborate on those. I know we've touched upon that in other podcasts. So I
Yes.
think within the Safe AI task force, we tried very hard to get limited English proficient respondents to the survey. We had a term, say, beneficiary, and it's okay, it's the helping model again. And I'm not sure I like the helping model, but that's kind of how the legislation and the regulations frame it. So we're sort of stuck with it. But we really didn't get as many of the people who are the real end users, as it were, of interpreting, the patients, the litigants, the witnesses, the parents in the school system, because it can be a real challenge to get very busy people who are working to establish themselves here in the US and provide for their families, and who might not be very comfortable speaking out about their issues. And that's been a real challenge for us, I think, collectively. I mean, we have tremendous participation from the Deaf Advisory Group, and I was privileged to participate in a couple of their workshops, and really vitally important. It's been much more of a challenge getting our LEP population to engage.
I do think that's gonna change. That's my hope. That's where I'm investing all the efforts, is in that word that we love, is empowerment, right? And I think it will get there, just the same way that other communities empower themselves to ask for their rights. We hope that that happens also with the LEP population. And again, since there is not a shared identity with limited English, because even though I mean, there is not a rally with limited English population signs kind of a thing. It's hard, but I think it will get there as people realize their own rights. And with that, I would like to ask Mila, what partnerships or collaborations has the Safe AI task force established with government organizations, industry leaders, or advocacy groups to advance its goals related to language access?
Before I answer that question, I also want to add that when we're talking about limited English proficiency population, we want to keep in mind indigenous peoples
Yes.
that live in this country that speak many languages, and we're kind of guests in their country. So the Native American languages spoken here and then globally. because AI is a global issue, not just a local issue. So it affects all populations where English is viewed as, actually I've heard people from indigenous communities referring to Spanish as a killer language, because it's viewed as a colonial language that, in a way, linguistic colonialism, taking away people's identity, is another way that has been addressed. So
we can do a full episode on that.
We can. And in terms of partnerships and collaborations, there will be many. To begin with, the initial partnership and collaboration is a historical coming together of all of the organizations involved in language access. And as next steps, we'll have a call for action for every community member, every member of our industry to be speaking out. We'll be presenting, creating, the survey results, the study results will be published. And it will take every single one of us in order to establish collaborations with the groups like the Biden administration has just established, with the groups have been established in healthcare, with the groups that are being established for looking at how AI will be integrated into everyday workflows and processes in other industries, and other in education, in healthcare and government and transportation. So it will actually, if we have one call for action, that's for everybody to be involved. It's not just going to be Bill, one as a singular person. It will take every single person who is involved in any capacity in the language industry coming out with a unified message, so that things are taken into consideration. And we're looking for broad collaboration, broad involvement. And it's important to establish those guardrails before something terrible happens, before there is a loss of life, before there is an unfair judgment in the courtroom, so that they'll still be established. But either they'll be established because somebody died, or if they're established before, and they actually end up saving lives, that's, I think it's up to us as an industry. And Bill, Carla, feel free to add to my answer.
I was just thinking, and let's not leave any of our children behind from the educational component, because they're struggling just to survive in a cyberbullying world and everything else that's going on in their world. It's so different than when I raised my kids. The other thing I think we have to keep in mind is, not that this should make us feel any better, Tim. It certainly doesn't make me feel better. But other countries are struggling with this as well. And they're struggling because language is also not part of their how people plan for them. So we've heard from Australia, they're a little bit more ahead, I think, Mila, would you say, in some ways? The UK has some stringent requirements, but none as stringent as some of the ones I've seen here, right, Bill? I mean, it's kind of more of a guideline. But I think that when you look at all of them, you'll really see that the language access component is either not present, or it's mentioned in very loose terms. So I think we should also remain open to hearing from other countries, because their struggles may help us avoid some of our own. We could learn from their lessons.
I'm sorry, do you mean with the exception of Australia and England, most countries don't have that component? Did I understand that?
Some countries have the components. I would love to get a list of the countries that are doing something. China, for instance, has some components. But again, they have components on AI. But I don't think anybody's really focusing on AI as it impacts language access. At least not like us, not like Safe AI is. I may be mistaken, Bill. You would probably know more.
The U.S. is unique, not because we're big around social justice, but we've been focusing on this longer. With the passage of the ADA in the early 1990s, with the case law around language access, Lau versus Nichols, LAU versus Nichols, the Executive Order 13166, we've been doing it longer, and our demographics have forced us to grapple with this,
However, Bill,
But-
if I may ask here, the ADA does not cover limited English proficient persons, correct?
No, but it covers the deaf and hard of hearing.
Right. I just
And-
want to make clarification on that.
In healthcare, that kind of gets merged together in Section 1557 of Obamacare.
Got it.
And,
Which is
there are
good.
other countries like Canada's just grappling with Indigenous languages. And you always have French and English in Canada and, language access there. It's just grappling with Indigenous languages. It's really just starting to grapple with the fact that there are two signed languages in Canada, two major signed languages. The UK lags behind us a bit in diversity, but is also, hyper diverse. And they're just really starting to deal with language access in healthcare. And they're starting to experiment with AI and language access in healthcare because they don't have the overarching legal framework that we have for language access.
I would like to give each one of you 30 seconds to tell me, if you had a crystal ball, what would you predict around artificial intelligence and language access? You can describe what you see happening at a corporate, cultural, educational level, whatever you can think of. But what would be your prediction with regards to AI and language access? And we can start with Mila.
All right. So I think the artificial intelligence will help us provide language access in areas where it didn't exist before. And at the same time, we're going to see establishing parameters where a human only approach is very critical based on risk. And risk is very individual. But I would also like to see, and I'm going to leave the other parts to Bill, Carla, and Tim, I'd like to dream a little bit big, and I'd like to say that artificial intelligence will have one or two impacts. One impact is, one of the predictions is based on limited access to digital world. There is a prediction that only 5% of the languages will survive in the future. And a language is a soul of a person, a soul of a nation. It holds so many things. So, but artificial intelligence also has the ability to reverse that to where every language flourishes. So my prediction is going to be, we're going to see every language flourishing with the help of technology.
Agree. 30 seconds, Carla.
Well, I honestly think, and I may be being a little optimist, but I think what Mila said about the risk, I think AI is going to identify a lot of risky situations where I think the value of an interpreter is actually going to increase. So that's what I'm thinking. And let's not forget our friends in translations, because I think that they've been battling this already for quite a while, machine translation. But I think that if we can get to the point, we know that we don't have enough interpreters sometimes to supply and demand. But I think what's going to happen is that people, I hope, get more of an appreciation to all of the nuances and all of the different things that we have to know that a machine is not going to know fundamentally. And hopefully it will keep us in the profession. Many of my interpreters were deadly afraid of OPI and of VRI. And guess what? We're still here, aren't we?
Yes.
So I'm hoping that the same will be said for us with the integration of, AI.
Yes, going back to your comment, instead of fear holding us back, we should, take the risk knowing more about the tools. Bill, 30 seconds.
I'll follow up on what both Mila and Carla said, that AI will change interpreting. And 10 years from now or 20 years from now, we'll look back and see different ways that AI has augmented the ability of interpreters, has complemented interpreters, has opened up new content, new use cases, right? But it will not replace interpreters, and spoken or signed, and there will still be critical applications where a human is absolutely essential.
Thank you. Tim, 30 seconds.
Yes, thank you. I've had time to kind of think about this, and there's two different directions. In a perfect utopia, let's say we have a perfect world, then we have deaf individuals, diverse community groups fully engaged and involved in the decision making process and mitigating risks. We would see improved access that would benefit their lives, enrich their lives. That would be great. Movies that are in have all movies having ASL interpreters at the bottom, having full access everywhere, every day. So, I know it's hard to get an interpreter sometimes, but I think that those would be great. We have lots of gaps to fill. At the same time, as an opposite of that, or another direction, is we have the rich, the powerful. They're making the decisions. That they are the stakeholders that are making long-term impact on these diverse communities of people. So, okay, saying what is the point of ASL? Why do we need an ASL interpreter when we have closed caption? So they're really truly inept in the full understanding and the scope of these diverse people. So a community,
Awesome.
where we're rich with language and diversity is so pivotal in these decision makings. And, several are LEP, are, limited English proficiency. And so caption doesn't work for that. So it's like, resources are sometimes a problem. What does the future look like? Celebrating diversity instead of looking at diversity as an expense or as a negative cost on society.
Thank you. And I just have three words. One is empowerment, the other one is inclusion, and the other one is partnerships. That's how I envision the future with AI.